The topic for today is understanding childhood tics. It's something that we've begun to see quite a lot of in our practice. And the purpose for today is to introduce the understanding of what the tic behavior, how it presents in children, to discuss causes, triggers, and how to assess the behavior in the children, and then to suggest treatments and provide skills to help relieve the stress associated with them and to help even resolve the symptom itself. So the child and the parents and the educators alike can all breathe a sigh of relief because it is a very taxing but not necessarily a long-term or distressing problem if caught early. Maria, if you'd like to say something.
Okay, so I don't know if anyone knows what we do as naturopaths, so I'll just give a very brief introduction. We do have to attend 4 years of medical training to understand what MDs do as well as NDs, so nothing interacts. We do not prescribe drugs. We just work with natural supplements, vitamins, amino acids, minerals. And just quickly to go through the principles, we have 6 of them. The first is to do no harm, so nothing that we prescribe will have side effects. So we believe in the healing power of the body to naturally heal. It has everything innately that it needs. If there's an imbalance, then we correct that by, like I said, recommending a vitamin, for example. The third is, we're really big on this, identify the root cause, because if you don't do that, then the issue can have a high likelihood of returning. So you're not really curing it. It's almost like a Band-Aid effect. And the fourth principle is doctors, teachers. So we're very big on educating and empowering. So you understand how to take care of yourself into the future. You won't really need us as often. And then we treat the whole person. So you're not just seen as a physical body, you're seen as someone with a spirit and mind. So we're huge on mental health. And a lot of the patients we're seeing right now, of course, are, I think 100% of them coming in, we're dealing with seeing, panic attacks, anxiety, depression, with what's going on in the world. And then the last principle is prevention. So we want you to feel great now, but very much so into the future as well. And the modalities we have at our disposal, things that we use are botanical medicines, which are herbs. There's hundreds available. Nutrition, which I'm very big on. So knowing what the right meal plan is for your body and treating everyone in a unique way. Homeopathic medicine, hydrotherapy, we do counseling, and we also do Chinese medicine and acupuncture. That's a little bit of what we do. And we treat everyone and everything, every condition in all ages.
Thank you, Mare. And I think part of the reason why I picked, or I had highlighted that I focus on tics is that I've seen quite a few children in the last few years presenting with them. And it was interesting, there's a concept where I tend to see, and I think Maria and other practitioners have noticed that sometimes you'll get a flurry of a very similar but somewhat rare condition to your practice. And it's actually an opportunity to learn quite a bit about how it develops, how to treat, how it differs from child to child. So tics is one of those. So that's why I like to focus a little bit more on that. Generally, tics are motor or vocal movements or functions that are often sudden or involuntary. They can be repetitive. The child sometimes has control over them and may feel like they have to do it. Blinking can be one of them. Certain body movements, flapping their arms, standing up, sitting down. Various audible sounds that they can do, like clicking or whatever it may be. These are common, and these tics can evolve and change over time. So often the child will come in. By the time they come in, they've already kind of evolved into 3 or 4 offshoots of what they started with. And it's always good to know where it started and what was the original. And the issue that usually the parents are coming in with is that the tic is now starting to interfere with their normal function. It's getting in the way of their schooling or their social interactions. And they're concerned that it may stigmatize or traumatize a child, and it becomes frustrating for everyone involved. And The tics usually are a sign of overwhelming stress for the child. It could be, real stress, or it could be just their perception of a situation, and the child doesn't have the resources to resolve the stress. It's something that it's beyond their capability of managing, and the tic ends up being almost like um, a materialization of that stress. It's kind of like a way for their body to manage it. I talk about Tourette syndrome because Tourette's is usually the formal diagnosis of tics when it's already been in present for over a year, 1 to 2 variations of tics, both audible and motor. But it's not super common that children get diagnosed with Tourette's. It does happen. I have some children that are formally diagnosed with Tourette's. Um, Part of that is when they're young, the attitude with various healthcare practitioners is that it's just a temporary symptom, it's just a phase, and they may grow out of it. And often that is the case. But in some cases, it does persist. And then having a formal diagnosis of Tourette's sometimes helps identify the child and can direct more resources to them. Usually there's a strong need for like a neurological assessment, and that's usually when the Tourette's is kind of prolonged over a year. But usually, the takeaway is that children often who with with tics in particular, are bright children. They have a high mental acuity, and they are particularly sensitive to criticism, sensitive to the needs of others. So these are usually children that are more bright than the average, which is an interesting factor because I guess we'll get to that. I'll allude to that in a later slide. There's some statistics here regarding Tourette's and regarding a Canadian study that focused on some older adolescents, that there was a prevalence of about 6 in 1,000 versus almost 0.5 in 1,000 for females. So it's about a 12-fold higher incidence in males, which is somewhat consistent with what I've seen in practice. I've seen many more males or boys that have tics at least, or Tourette's versus females. But with time and as they enter adulthood, those numbers seem to even out. And then what was interesting, the study also highlighted that those who were diagnosed with Tourette's had ended up with overall lower education, lower potential for income and employment into adulthood. So on the previous slide, I highlighted that it's very common to find tic presentation in children that are higher achievers and do well in school. But if it's somewhat not treated or not diagnosed early enough or addressed, the Tourette's can have a real detrimental effect on their long-term development. So that's why we really want to focus on it as early as possible. Usually the conventional treatments would involve perhaps just monitoring and hoping that it would, the tic would just disappear over time. And many times it does, but other times it tends to kind of become more of a remission, and it sort of hides itself and shows up under higher periods of stress. When there's a persistent tic, often there's a psychiatric assessment and cognitive behavioral therapy can be offered. And then in more severe cases, there'll be a need for antipsychotic medications where there's a high concern with side effects. And then lifestyle modification in terms of their education, just to accommodate the child, because the tics end up being at a point where they can even interfere with their ability to sit down and do a task and do their homework. Ultimately, we want to know what the cause is. And specifically, there's no formal known cause. We can conjecture that there's a genetic component. And we can see that because usually one of the parents will say, well, I suffer with some mental health, or I have high anxiety, or I myself have had tics in the past. So there's that often shows up in the history. some studies have shown that tick presentation is higher in winter or cold months. And some postulated that there's a correlation with vitamin D levels dropping off, or lack of sunlight, or like SAD, like seasonal affective disorder, can be a role or a contributing factor to an increase in the nervous system stress that one would be experiencing. Along with tics, often children with tics will have as concomitant condition in the ADHD, autism spectrums, some OCD behaviors, sleep hygiene issues or sleep disorders and insomnia, depression, and various other forms of anxiety. And these are also very important things that we want to assess and to see there how if there's some kind of common factor that can be contributing to the actual tic. For our own practice and my observation with my patients, as young as 4 years old, we've had children come in with tics. Most of them have been boys, but actually a lot of the patients of late have been female. So there may be something, causing the playing field to be evening out. I can't speak to why boys historically have had more tics, but at the point now where I see boys, males and females pretty equally. And as I mentioned earlier, often the parents had tics or some form of anxiety condition in their past, especially as a child themselves. But what is really interesting and probably the crux of my study in the topic is that in each case, there's a significant start point that commenced the tics or brought them to the surface. So almost every case that I've seen, there's been either a severe illness or injury or emotional episode that was a catalyst or a trigger that brought one of the tics to the surface. It persisted and then led to an evolution and more complexity to the tics themselves. And even if a tic tends to subside, and a lot of parents, they'll give me the feedback that at some point, it seemed like it was getting better. Maybe so. We'll come up with a make-believe child, Jimmy, and he was having tics, and then after 6 weeks, it tends to got better, and then about a few weeks after that or a month after, it came back, or came back in a different way. Often there was some kind of trigger. It could have been another stressful situation. It could have been even something minor. So once we've reached some kind of threshold, it seems like the child is more sensitive or more likely to develop and maintain the tic behavior. So what we want to do with, especially through a naturopathic assessment and treatment, is to have a reduction in their experience of the tic, reduce the number of times it's showing up. Now, tics can be they can be consistent, like constant. The child will have them from every waking moment until they go to bed. And I've seen that. I've seen where the child is like, looks like they have ants in their pants. They can't stop moving. And then there's other times when it kind of just flares up every few moments or a few minutes, or there's times when days will go by. And so our goal is to resolve it completely to the best of our ability, and to the best of the ability of the child to heal from it or reduce its influence on their life. The parents tend to bring their kids in because the tic is so obvious and it's interfering with everything that they're doing. It interferes with their schoolwork. And so when we see the child in the office, we can obviously see the tic. And I've had children come in where I hear them coming into the building. I hear them in the waiting room. I hear their interaction with their parent, and their interaction, other than the tic, it would be seemingly completely normal. You wouldn't tell, except for when the tic presented itself, that there was something wrong. Especially if there's a motor tic. I mean, you don't necessarily, if you're not in the same room, if you're not looking at the child, you won't see it. But it could be something as clapping, fiddling their fingers, moving their leg. There could be so many different motor tics that, I mean, we'd have to be watching them to assess it. And then from there, what we want to do is do a comprehensive history where we're looking at everything. We're looking at the timeline of when it started, everything since then, everything before then, and if there's anything that the parent is able to observe that makes the tick worse. And often the parent does notice that it's like, hey, you know what? They had a really bad night. They didn't sleep very well. The next day, their tick was really, really off the chart. Or if they had a bad day at school, or they had a fight with a sibling, there are always things that are aggravating factors. And during the assessment, we were also looking at other levels of mental health and other concomitant concerns. And I also want to know how well they're doing in school, if they are enjoying school, if they're thriving, or if where there's deficits. And we also want to look at their sleep. Sleep seems to be a really big factor. We also discuss immune health, digestive health, if they have allergies, any other known food sensitivities, if they're a picky eater. And then we kind of use that information to come up with a detailed dietary program and some supplements that are age appropriate. And we're trying to reduce, again, the incidence and how frequent the tics are showing up. A lot of our assessment also includes what the parents they're noticing. Parent feedback is really important because the child themselves may or may not even be cognizant that they're doing it. They may know. Usually the older children, they are much more familiar with when they're doing the tic. A lot of the times they are understating it. But if the parent will say, well, were you doing your tic at school today? They'll be like, no, not really. But then when they talk to the teacher, they'll be like, yeah, they were doing it quite a bit today, actually. So the child either is hiding it or they're not necessarily fully recognizing that they're doing it. In addition, we always want to kind of incorporate the medical doctor and any other healthcare practitioner that they're seeing. So we would want to know if there's any other concerns, any medications they may be on, and to do some blood work. If they're their family doctor, that would be great. If not, we can also run it ourselves. We're also big on food sensitivities. Our experience, tics aside, food sensitivities have a huge influence on a child's ability to focus in class, to just maintain a healthy mood. We notice that mood is very influenced by either food triggers or timing of meals. We also would look at neurotransmitters because that can be a factor in the presentation of the tics. And we also always do in-house a urine stress test. There's a urinary metabolite for cortisol, and it often gives us a good feedback on how stressed the child is physiologically. Often, again, they're not aware that they're under stress. We can ask the child, and the parent can do their best guess to say, like, oh, okay, I think they seem okay other than the tic. But when we do a urine test, and we can see, like, okay, so-and-so is off the charts in this metabolite. Are you noticing X, Y, and Z? There's various things that may be occurring. And then they're like, yeah, a matter of fact, now that you mention it, yeah, these things are happening. So these are part of our assessment and the different tools that we use in office. Part of the treatment we can start in office is I like to offer acupuncture, especially for older children, if the child and the parent is comfortable with that. Traditional Chinese medicine is very useful in terms of giving a backdrop to understanding why the child may be feeling the way they do, why the tic may be presenting. And there's certain common points that we can do with the acupuncture that the child will feel like a little bit just a sense of being calm. We can actually notice a reduction in the tic behavior while they're having a treatment, and often can have a lingering effect for the days and weeks following the acupuncture. If acupuncture is not on the table, if it's not an option for them, what we do is we have a conversation about the tic, and we try to get the child to kind of recognize the impact it has, and we try to identify if there are actual triggers, like lifestyle triggers, emotional triggers. So we focus on the child talking and speaking their mind and saying, whatever comes to them. We don't really want to lead the child. We don't want to kind of put ideas in their head. But often when they get comfortable and they're in a setting where they feel like they can discuss things, we usually start talking about their diet, because that's something that the child usually has a sufficient understanding of. Is like, what food am I consuming? And when they start explaining their diet, they have this comfortability that they start expressing what they notice about the tick, or things about school, or their friends, or their siblings, or their parents. And then the conversation starts to build from there. And then often we'll identify if there was an original cause. And thinking back, there's one or two very like standout examples. One child in particular, he had fallen off a platform and had a dental injury. So following the dental injury, he would begin to make like an audible clicking sound with the front of his tongue against his teeth. It may have been that there was some kind of deformity or swelling that was there from the injury, and then that ticking sound or clicking sound rather, it continued even after the injury had fully healed. So that was a good example of there was an initial trauma, a very specific trauma to that area, and the tick itself, the clicking was connected to that area. So the area healed theoretically, but the tick remained. So in his case, what I did was we put together a protocol that worked on there's various herbs and some homeopathics that are very specific for that area of the mouth that help reduce like any kind of lingering damage and swelling and some nerve, most likely nerve damage that had occurred there. And then that's when they had a resolution of the tick, even though the tick had already evolved to a few other versions of itself. Another a good example was an individual, a young guy who came in following a series of strep throat that he was doing. It started as a throat clearing tick, which then eventually evolved into like almost like a hooting sound that he was making, like a deep a vocal sound, and that became constant. He just kept on making it for months and months after he had that initial strep. He was just like doing that hooting sound, and it wasn't until that we actually addressed the throat infection and any kind of residual swelling in the lymph system that was there, draining of the sinuses. That's when, and also working on the nervous system itself, plus some confidence building. That's when we found that the tick completely resolved itself. So those are some examples that I want to bring up in terms of just the idea that there was an initial cause, some example of how it might have started, and addressing the actual trauma itself. In addition to, and that's it's a very straightforward case. In some cases, we've had to focus on diet because there's a few conditions where, a few cases where the individual was, their diet was just went out the window. And a lot of stress, and part of the stress was related to body image. So the body image was starting to contribute to a formation of a tick, a motor tick, where they were kind of adjusting their body, almost like kind of like hiding their abdomen. And then what we had to do is like literally we worked on the diet to give them just a healthy diet plan. It wasn't about weight loss. And then we also worked on their nervous system with some nervines that I'll get to. And they noticed that the motor tick, the body tick, started to resolve. So whether it was their confidence was improved because they were eating better, or there was some kind of neurological change, the end result is that they started to relieve the issue. But digestion and diet overall are critical to assess. I found this was interesting on the Tourette's.ca website, that they actually highlighted these 10 foods as possible tick triggers. Now, this is a very general list. Now, I don't think that any one of these on its own would cause a tick, but they had some research suggesting that individuals with tics may have an increased frequency of the tick behavior, and those with Tourette's, if they had an overconsumption of these foods. Now, looking at this list, what I would do is I would identify if the child had any food sensitivities. But prior to that, before we do a test, what we're looking for is regularity of their bowels, if they have any bloating, if there's any kind of skin issues like eczema. So there's various things that could be causing like a flare-up And then we would want to see if there was some kind of antibody reaction to various foods. And the 10 foods that are listed here are often most of those that would show up on a sensitivity test, but not necessarily all of them. And sometimes it's not necessarily a sensitivity. Sometimes we're looking at, blood sugar control. So generally, I find that any form of anxiety, and I think tics can fall under the overall paradigm of an anxiety state. Blood sugar, drops in blood sugar can trigger the tics to have a higher frequency. Blood drops in blood sugar can trigger panic attacks, could trigger changes in mood. And these are things that we'd also want to assess for the child. Sometimes children are having, like, they skip breakfast, or they have a very high sugar or high carbohydrate breakfast that without sufficient protein, their blood sugar will start to drop within an hour. And with that, for many children, they'll find that their mood and their focus and their ability to kind of just have a normal day is compromised, because they start getting signs of being hangry or cranky or irritable until they eat again. And then if, again, they're having a carbohydrate heavy meal, again, they're going to have a spike in their blood sugar. The insulin's going to rise and fall too quickly. They won't feel satisfied. And then again, their mood can be dropping, and this can as well increase the likelihood that the tics will present themselves. Sleep also seems to be a factor, and every case that I've assessed, the children are just not sleeping enough. And I think there's a lot that we are lacking in the public sphere in terms of how many hours children really need to sleep. We think 8 hours is sort of standard, but we're looking at 10 plus hours for most young children. And it's not just the length of time, it's also the start point of their bedtime. A lot of parents say, well, they get their 10 hours, but they're going to bed about 10 o'clock, and they're sleeping until about 8 if they can get to school on time. But there is an issue that they've already been up for too long. Sometimes a parent will say, well, they're not tired, they're restless, they don't want to sleep. They're just tossing and turning, so I'd rather just them come down. And then, but what we're noticing is these are overtired children, which is, I call it paradoxical, because a child that seems to be very hyper is probably overtired. And a good way that indicates this is if they're the first one to fall asleep in a car ride. Usually the child that's the most rambunctious, within 5 minutes of a car ride, they're already kind of, they're already conked out in the back seat, which is always a good indicator that they're not getting enough sleep at night. And every parent has reported to me that when the child is tired, that the tics are more frequent. Another interesting factor in terms of sleep is that because these children that have tics are usually very intelligent, they have an overactive or a very busy mind. And those with busy minds have a hard time falling asleep. They're the ones that are like, after an hour of bedtime, you still hear them tossing and turning, or they come down for water, they go into the washroom, they have a hard time to sort of like getting into that sleep state. And that has a lot to do with the overstimulation of their mind. And in Chinese medicine, there's a good explanation for this. And what seems to be correlated is children that are very smart, that they think a lot, they have a compromised digestive system where they're not able to produce a sufficient amount of stomach acid at the time of a meal. Then they start having a deviation from having more protein dense towards more carbohydrate friendly meals, because they're easier to digest. So these are the children that are starting to have more breads and pastas and steering away from their meats and more complex veg. And then you start noticing that maybe they have a little bit lower iron. They're the children that look a little bit more pale. They might have a little bit more of the darker circle under their eyes, but they could be very energetic. But that's what throws you off, is that they're actually probably not absorbing sufficient protein to make them feel satisfied, which is building up what we call yin, or it's like a grounding substance. When you have sufficient grounding substance, enough nutrition, you will find that the overstimulation of the brain is less. They are less overthinking. And one of the main things to notice with children with tics, that they're the kids that are listening to mom's conversation. They're the ones that look like they're playing, but they look like they have one ear to the wall and paying attention to things that are more adult nature. And then they will come and ask mom, it's like, Mom, I heard you talking about so-and-so, are they okay? And they'll be like, well, how do you even know that? Why are you listening like that? Don't worry about that's not for your age. And the child will recognize that, but they don't necessarily know how to manage it. So these are children that are higher intellect, but because they are still a child, they don't have the depth of maturity to know that, okay, that's not something I should be worried about. So then things that they don't know how to process, it kind of lingers and it stays with them. So this is where they start developing this overly concerned nature, start asking about more significant things that they shouldn't be knowing, like about life and death and diseases and problems. And so now we start seeing a presentation of a child that is just knows a little bit too much for their own good. And when that's the case, there are various conditions that start to develop, and the tics end up being one of them. So I've sort of displayed a little bit of a foundation where these are children that overthink, they kind of know too much. And then when there is a significant set point, something that kind of triggers an injury or an episode, the tic is a means for them to let off steam. It's a way for their body to kind of process something that intellectually they don't know how to handle. So that's where a lot of our kind of assessment and treatment are focused on bringing the child back into a childlike state and getting them to sort of separate themselves from problems that are not for them and focusing on child appropriate concerns. So one of the main things I'll talk to them about, I'll be like, okay, so there's making your bed in the morning and then there's mom's conversation with somebody. Which one is for you to be concerned with? And they'll always say, I should be worried about making my bed. Okay, there's, having your breakfast, or there's doing your homework versus, the news, something on CP24. And of course, they'll recognize that, I should be doing my homework. So then it's like, okay, so let's let mom and dad deal with the parental issues and let's let you work on what's yours. And that's how they start building up, again, more confidence and start delineating what they should be knowing and paying attention to, and start getting them to have a little bit of this less of a stressed or the red alert, and bring down their alertness level so that they're not so concerned with what's going on beside them. Often we'll do this in addition to, their conversation and confidence building. We'll prescribe some supplements, and usually they are, children friendly, things that it's not, taste is not an issue. Dosing is never a problem because it's based on their age and their weight. And something that we use a lot of are called nervines. Nervines are just herbal formulas. Some of them are very common. A lot of people use like passion flower or chamomile. Those are some very basic examples, but there's some complex formulations that we would use that will help reduce this overstimulation of the brain. And with that, we start immediately seeing a reduction in the tic behavior. We also would work on immune support. If there was a immune or an illness trigger to the tic, like I had mentioned, strep throat. So we would treat a strep throat naturopathically months after the strep had already been resolved, let's say with antibiotics or just it's run its course, because there's often some lingering lymphatic issue, something in the area that's become weakened that had created that trigger, that clearing throat example I kind of refer back to. And it's a combination of working on the nervous system and treating and healing that initial trauma that seems to kind of give us the best results in terms of reducing the tic presentation. I know this is probably it's not commonly held. It's not a very well-known medical mechanism of how tics are presented or treated, but this is how we've been able to have success and how we've recognized its creation and origin, and how our children have had benefit from that. Okay, so most children are able to reduce their tics to a fraction of what they initially were, or have even complete resolution. People and parents will often ask, well, will the tic return? And there's always that possibility if there was a repeat injury or high stress or going back to old habits. But usually these are more of a short-lived reaction, less severe. And then the parents already have an idea of like what to reintroduce. Okay, let's get back onto that plan that the naturopath gave you. And then they start seeing that there's a resolution again. And thankfully for most children, they can outgrow tics. And they tend to kind of go away with time. They also, as they get older, sometimes they have control over it. Sometimes they'll just do it at home. And as they get older, then that's when we would be working on more nervous system support. And it's a little bit of a different playing field because we're managing actual life stress. But when we're dealing with children, we try to get them to focus on just what they need to focus on as a child, and allow the supplements to kind of work in the backdrop. And most of the time they have the complete resolution is what we're always looking for. And in conclusion, the tics are the result of an emotional stress due to lack of understanding, experience, maturity, as I mentioned, of how to handle what their intellect perceives. Their development has to match their maturity. So that's something that that when that happens, that's when the tic no longer persists. So often if a tic kind of disappears over time, it's probably because they kind of outgrew it. They became a little bit more mature. The things that were beyond their reasoning as a child, when they get a little bit older, now it's not so overwhelming, and then the tic sort of doesn't have a purpose anymore. And something that we see is we try to bridge and connect the interaction of a physiological or immunological stress with the cause of the tic, and then to work on the child's emotional state, self-esteem. And ultimately, once the tic is gone, the child is more balanced in their mood. They have more confidence, they're more engaged, and they kind of like, they get to a point, like they kind of progress through it and they're better for it in a sense. They're kind of more mature for it, and happier. And that's ultimately what we're looking for. So we'll try to engage the chat if anyone has any questions. I think Maria can moderate and read out.
I don't see any questions if anyone wants to type one or...
And if anyone has any questions after the fact, so I'll make the slide presentation available through the portal. And here's our contact info if anyone's interested. And we're on Instagram, and you'll find us posting information every so often. So I'll just leave that for a moment.
If I may add, Jason, if it's okay to jump in,
yeah.
Just to touch upon the importance of nutrition. So I'm huge on nutrition and understanding what works well for you. Everyone's very unique. And like we mentioned before, everything is connected in the body and with health. So what seems very disconnected, such as the digestion and the nervous system, your mental health, is very much connected. So if anyone's ever done a detoxification plan or a cleanse, because the gut is not very irritated at that time, the mind should be very calm. So I'm huge on, like I said, nutrition food being your medicine. What you eat works well for you. So the test Jason mentioned, the IgG, is a blood test, and it basically lets you know, okay, your body likes and agrees with and does well with these foods, but then other certain foods you have to avoid. And what's interesting is the children that I've tested, they tend to have quite a few sensitivity. Would you say more so than adults? Like some I've seen maybe 40, 50 foods they have to avoid. So it's quite prevalent, quite common. So if we can clear those foods, their mind's not, and nervous system is not as irritated. So we really focus on nutrition, but also just the basic building blocks of health, which is stress management, sleep, as Jason talked about, and just looking into even basic vitamin levels. I think you talked about vitamin D could be low, and that could bring on the tic. So we're very, very big on, do you have the basic building blocks you need to feel your best, to feel healthy? And that's different for everyone. So the goal is to identify, again, what treatment plan works for you. And like we said, we have so much at our disposal: supplements, nutrition, lifestyle, stress management, sleep. So we incorporate all of these, especially for children, our own children, like sleep training, for example, just to make sure that everything, like we said, that basically needs to happen for you to feel healthy is happening, to identify not only what is coming up in your health, but to also keep you healthy in the long run to prevent further conditions.